You can also talk to black boxes, but it's always better when I get to have your energy too. Well, thank you so much for joining today. I'm really excited to be back here to talk more about policy and advocacy. I had a lot planned for these two sessions, and unfortunately we didn't get through as much as I was hoping last time. So I'm just kind of going to adapt a little bit as we go and see how things are going. So I have a lot of slides. We won't get to all of them, but I just wanted to give you the heads up as I'm skipping through. It will just depend on where our conversation is going. Does that sound good? Awesome. Okay, let me share my screen here. How was your session right before this? Anybody want to tell me what you talked about a little bit so I know?
It was good. They talked about like kind of the statistics regarding like children, according to the AAPD and like the NCDR. So like percentage of children who have like treated versus untreated caries, percentage of children who are smoking or like doing drugs, and see a lot of improvement in all those fronts.
Awesome. That's great. Thank you. Okay, so last week, correct me if I'm wrong, but I think we ended by talking about government agencies and regulations. Does that sound about right? Yeah. No.
Yeah, I think so.
Yes. Okay, cool. So basically we were going through the policy making process. And so I just wanted to kind of follow up with the last few. So what are executive orders? Has anybody heard of an executive order before?
It kind of bypasses the other branches and is by the executive branch.
Yeah. So an executive order is a proclamation by the president at the federal level, or it could be the governor at the state level. And it's a proclamation that has a binding effect. So just like every branch of government, there's limits to this power. So the governor or the president has to have the authority to create the executive order. And sometimes it can be controversial because sometimes they're done when the legislature, for example, can't come to an agreement about something. If it falls within the president's constitutional powers, then they can create an executive order. And so the topics that they've covered have ranged from things like immigration to healthcare, for example. And they can really play a major role in health policy. And a really good example of this is through the response to the COVID-19 pandemic. So executive orders really can help address emerging public health issues, especially when their processes are a little bit too slow, like the legislative process. And so across the country, different states had related executive orders, such as in California, there was a declaration of a state of emergency, there were stay-at-home orders, extensions of deadlines, among other things. And one that's particularly relevant to dentistry is that through an executive order and then through kind of administration at the government agency level, it allowed for dentists and dental hygienists to help play a role in vaccine distribution. So I'm just curious what you see in your, like with your clients. Do you talk at all about COVID-19 vaccinations, and do you know any other kind of dentists or dental hygienists that have been involved with COVID-19 vaccine distribution?
Yeah, we talk about it a little bit. We at this point, instead of the people downstairs doing the COVID screening, we actually do the COVID screening, so it can open up a nice conversation to talk about, if they've had the vaccine. And even some parents can ask, like I've had a parent ask me before, like, have you been vaccinated or have you been boosted? Like, I guess she just wanted to know. But yeah, so we do have those conversations at points in times. I'm not sure though who has been involved in actually administering the vaccines as far as dentists and dental hygienists.
Awesome, thank you. Does anybody want to add to that? So, oh, go ahead.
Well, I was going to ask if you meant like in specific our delivery of the vaccine itself, or just kind of around the topic of discussions of vaccinations and things like that too.
Yeah, I was asking about both, if you're involved with either of them or if any of your colleagues are. But through the executive order, it actually paved the way for dentists and dental hygienists to be able to administer the vaccine through some sort of a administrative process. I think it was through like a waiver. Did you want to add something?
Oh, I was going to say, oh, sorry. Yeah, I was going to say that, yeah, I remember that that was part of the conversation when I was working last year. However, I don't think that it actually ended up materializing for a lot of practices because of the fact that there were fewer doses and everything. And very obviously it would be going to the appropriate avenues, and only if they were being overwhelmed, then it would come along to the dentists. But I think that was before we really explored the topics of vaccine hesitancy and things like that. So I don't know of any of my own colleagues that have actually given the COVID vaccine, but I do remember this being part of the conversation of dentists being able to give the vaccine.
That's awesome. Go ahead.
It's honestly a good point that you bring up too. This is obviously a smaller population of people that I'm about to speak about, but when we do IVGA, like the general anesthesia cases, we're already giving them an injection, and then they obviously go to sleep after that. So a lot of these children who might have developmental disabilities and different things like that, it would be interesting to have that conversation with the parents to see if that would be an ideal time for them to get that done as well. So that was a really good point that you brought up.
Really interesting. Thank you for bringing in that additional perspective about individuals with disabilities. It's a really kind of important perspective to be considering, both in terms of pediatric dentistry, but also public health more broadly. So this screenshot is just an evaluation that was done, I think, by the American Dental Association, and it's really interesting. And when you look at meeting a patient where they are, and I think Vishnu or Marissa, you kind of brought this up, the idea of being able to have those conversations at an ideal time when they're open to having those conversations, and then help address some of that misinformation or mistrust and really make it accessible. It's also been really helpful in like rural areas to have, to be able to offer vaccines with dental practices. Awesome, thank you. So here are just some resources if you're interested to how states have handled executive orders related to the COVID-19 pandemic. There is a resource related to that. I just want to quickly touch on the judicial system as well. So the court system serves as a really good avenue to do health policy and to create health policy change. So the judicial system in the United States is built upon this idea that relies on case law. Has anyone heard of case law before?
Something like precedents, like basically laws are created through just court decisions on like cases, and then those set a precedent for laws, I guess.
Exactly. So in the judicial system, you have to have parties to the case, and there has to be some sort of dispute. And then just like every branch of government, there has to be the authority for the courts to really look at it. But the cases really only apply to the specific parties at hand. But the cases all build upon each other, and that it creates that precedent that Matthew had mentioned, where you kind of build upon those cases, and that's how we have like the overall body of law. So there's judicial systems in each of the 50 states, as well as at the federal level. And as public health professionals, obviously you could be a party to a case in which you'd be directly involved with the judicial system, but also public health professionals and the organizations that you work with or other professional organizations that you're affiliated with can get involved in the judicial system through what's called amicus briefs. Thumbs up if you've heard of an amicus brief before. So it's a really cool, cool tool. And the idea is that you're a friend of the court, and you might be interested in the case, even though you're not a direct party. And so then you can file a brief in which you can present the arguments and explain interest in the outcomes of the case for the court to consider. So I have a few examples that I normally give, but for the sake of time, I'm just going to skip through them. The first is there was a case in California around diabetes care in the school setting related to discrimination. And it also touched on issues related to the scope of practice, specifically the Nurse Practice Act. It was a case that went all the way up to the California Supreme Court, and ultimately schools were able to accommodate kids with diabetes despite the Nurse Practice Act. Another example here is related to the sugary drink beverage cap rule. So does anybody remember when New York City tried to ban the sale of jumbo sugary beverage drinks? I see a couple head nods. It's a really interesting case. So basically the idea was that you couldn't, like, food service providers couldn't sell sugary beverages that were above, I think it was like 16 ounces, something like that. And then obviously that has public health benefits related to oral health, but also childhood obesity. Ultimately though, the case, it was through a regulation, and the regulation was not, it was seen as exceeding the administrative branch's regulatory authority to implement that type of a regulation. And so that was struck down. But even though the regulation didn't last and the ban didn't last, it actually may have had an effect on political will to address this issue of sugary beverages and the obesity pandemic. And then the last example that I normally go into more is around the US Patent and Trade Office. So there was a patent on the breast cancer genes, BRCA1 and BRCA2, and those that really restricted research. It restricted a patient's ability to get a second opinion, and the tests were really, they had like high fees associated with it as well, which made it inaccessible for some. And so ultimately, after working its way through the US Supreme Court, it was found that you can't patent gene sequences because they're a product of nature, and therefore they can't be patented under the law. This really has huge implications for research and healthcare access. Any questions about the judicial system and how it can play a role in healthcare policy or public health policy? Great, so just like the other slides, there's a resource slide. Now I want to take a few minutes to talk about ballot initiatives. So does anybody know what a ballot initiative is? In California, you might hear of them as propositions.
They're kind of like referendums for the voters.
Yeah, so who votes on them?
The public.
Mm-hmm. Absolutely. So it really bypasses the role of the legislature, right? So it's the people saying, this is a policy that we think is really important, and then the general population votes on it. So some examples of things that have appeared in propositions or ballot initiatives is legalization of marijuana, for example, or daylight savings, getting rid of it. I don't know if anybody remembers when that was on the ballot. I think it passed, right? But we still have daylight savings. Anyways, I want to look at some examples. So I'm going to play a couple of videos for you. And I want you to think about advocacy as it relates to propositions. Okay, so I think I can, okay. All right, just give me a thumbs up when I press play to let me know if you can hear the sound.
Good schools are important to my students and California. That's why voters passed a law to ensure that schools get 43% of any new tax revenue. I was astounded to learn that Prop 56 was written intentionally to undermine that guarantee. Prop 56 raises $1.4 billion a year in new taxes and gives most of that money to wealthy special interests like insurance companies. But not one penny goes to improve our kids' schools. That's just bad math. Good.
Okay, so what do you think that's about? What do you think that proposition's about?
School funding.
Okay, school funding. What else? Any other thoughts?
Can you play it one more time, please?
Sure.
Thank you.
Schools are important to my students and California. That's why voters passed a law to ensure that schools get 43% of any new tax revenue. I was astounded to learn that Prop 56 was written intentionally to undermine that guarantee. Prop 56 raises $1.4 billion a year in new taxes and gives most of that money to wealthy special interests like insurance companies. But not one penny goes to improve our kids' schools. That's just bad math. Good.
So I guess it's, sorry, you go first.
I was just gonna say it seems like it's voting against Prop 56 because it's not benefiting the schools and the kids in any way.
Mm-hmm.
So it actually doesn't give much information on Prop 56, and I think it relies on, or it pushes the onus on the voters to actually do the research on it. And I was just looking it up, and
Oh, don't tell everyone. Don't tell
it
everyone.
has nothing to do with any of this.
We're gonna play another video, and then you can chime in on what it's actually about. Okay, any other thoughts before we play the next one? All right, let's play the next video.
Because she doesn't know that it kills 40,000 Californians every year. Because she doesn't understand what cancer is. Because she can't spell emphysema. Because she is a butterfly who fights fires. Because she is my daughter. And the Surgeon General says that raising tobacco taxes is a proven way to make sure she never smokes. That's why I'm voting yes on 56.
Okay, so what do you think that video is about? And do you think it's about the same thing?
Yes, it's about the same thing. It seems like, well, I kind of now want to talk to Vishnu on the side because we're looking at myself, but it seems like it's about tobacco taxes and what the money goes to. So it seems like it goes to, like, yeah, because they're talking about doctors, dentists, health plans, labor, hospitals, etc. But then the teacher is basically saying that although the mom here is saying it's influencing and helping the children, it's really not, because none of it is going to their actual education, and so they're losing out on money.
Any other reactions to the video? Vishnu, you want to share what you read?
I think, yeah, Marissa is spot on in that it is increasing the cigarette tax by $2 per pack. That was part of the ballot initiative. And I think this sort of campaigning against it can come from, I was thinking, two completely different schools of thought. One is folks that kind of agree with the fact that the smoking needs to be taxed, but they want to rewrite where the money is being appropriated. And it could also come from folks who do have ties with the tobacco industry and want to reframe this conversation in a way that just gets rid of this proposition for right now and doesn't appear again on the ballot anytime soon, so that they can push for lobbying efforts in the meanwhile. So I was just thinking, I was kind of wondering for the previous video, who the sponsors were, what their motives were, and all that sort of stuff.
Yeah, I think if you look at the fine print, you might be able to see. They also, I think there's like a no to Prop 56 website, and also through, if you kind of read the proposition, you can see who's against it. But yeah, it's a really good point to think about who is supporting it and who's not. So who do you think the videos are targeting?
Mostly parents of children.
Mm-hmm. Anybody else? So as you're watching those videos, is there any additional information that you'd like to know? Like thinking about being a parent or a potential voter?
I feel like I want to know exactly what Prop 56 is, because I feel like it's not very clear.
Yeah, absolutely.
I'd also like to know exactly like the breakdown of where the money is going.
Anything else? And how do you think that people make decisions about what propositions to vote on?
Probably like emotional based.
Friends and family.
Okay, so networks like friends and family.
Some also like these commercials and TV shows that they may have seen.
So through the media
Mm-hmm.
and other kinds of advertising.
Mm-hmm.
Great. So as you can see, the videos really present a lot of hype over the different issues. And in some cases, they reference what's written in the proposition, like I think how the school teacher one, for example, cited the proposition and talked about the special interest groups, which is really interesting because it does go, some of the money does go to healthcare, but specifically Medicaid, and specifically supporting vulnerable populations and addressing kind of health complications and prevention related to smoking and the complications related to that. So basically how taxes typically work, just to kind of address that school video with the Long Beach teacher, a set percent of general taxes goes to schools. But then what happens is you can have a special interest type of a tax that can be allocated in a different way to kind of further whatever the tax is really meant to address. And so the funding was supposed to be allocated to schools for like after school programs and prevention efforts to prevent teen smoking. Some of it was to go to law enforcement to support the enforcement of like smoking related things. Some of it went to Medicaid, for example. And so it's not that it was cheating schools out of existing taxes, it was just kind of reallocating funds to be relevant to what the specific tax was about. So I think this really highlights, as we see a lot with the pandemic, just that idea of misinformation, trusting your sources, and then also the need to fact check. And not just fact checking by watching one of these commercials, for example, but really going to the source of the text and understanding kind of what it says. So I have, there's two other videos which we don't really have time to watch, but they're linked in the PDF that I'll send. So you can watch them. And it's actually kind of funny because there's some parodies on it on YouTube that are pretty hilarious because there was a huge campaign around it. So then there's also organizations like KCET, and they provide 1-minute segments on propositions that are really helpful. They're supposed to be unbiased. They're not always completely unbiased, but the idea is that it gives you like a rundown of what the proposition is, and that from a more neutral perspective, and then you can make a more informed decision. But I think these videos really highlight, one, just some different advocacy strategies, but two, really helps us think critically about those advocacy efforts and the benefits of the different types of policymaking processes. Any questions so far? So advocacy is really important in getting policies implemented, but then it's also just as important to be thinking about like what you do once you create the policy. So it's been kind of interesting to watch how implementation of, so Prop 56 ultimately was passed, but it's been kind of interesting to think about the implementation side and how you advocate to ensure that the funding is going to the right places and who's actually getting the money. I'll save implementation for a totally other discussion, but it is something that's really important to be thinking about, is sustaining the advocacy efforts once a policy is put in place. Okay, so there's some resources for you. Private businesses also can be a great place to create policies. And yeah, okay, so private businesses can be a great place to, sorry, I'm trying to see if I skipped a slide. No, I didn't. Okay. So they can have an impact both on individuals and also on population health more broadly. So for an example, an organization can have a policy that encourages employment of individuals who are formerly involved with gangs or formerly incarcerated. You could also have a private organization that has a policy around the use of public spaces, which would have a really big impact on individuals experiencing homelessness, for example. Organizations can also provide training and resources and other things like that that can ultimately have an impact on public health. So I want to look at a quick example. So back in, I think it was 2014, CVS stopped selling cigarettes in some stores. Does anybody know why they might have done this? What do you think their motivation was? And I'm sorry, it wasn't in some stores, it was in all of their stores. Does anybody remember when CVS pulled tobacco off of their shelves?
Was it after they implemented the cigarette tax?
I don't, so cigarette taxes are usually state specific and CVS is national. So I'm not actually sure if it did correspond with a cigarette tax in some area, but that's a really good point. I'd be interested to know if that was related.
Is it because they're like a pharmacy? Oh.
Go ahead, Matthew.
Yeah, Matt, you can go ahead. I was literally gonna say something similar, so go ahead.
Probably. I think Marissa is on the right, like saying the same thing, but like it's because of their pharmacy and they're supposed to be for health.
Yeah, so pharmacy and health. Okay, Marissa?
No, that's what I was thinking. Like, it's kind of interesting to be selling one thing that's promoting like good and health and like welfare, whatever, versus cigarettes.
Yeah. So I can't tell you the exact reason, but I can tell you what I think the reason is. So it actually corresponded to a rebranding campaign. And so Matthew and Marissa, you kind of alluded to this a little bit. So it was at the time when CVS was going from CVS Caremark, or just a place to shop, to CVS Health, which would be more of a healthcare hub. And so along with that transition and along with pulling tobacco from the shelves, CVS launched a Let's Quit Together campaign to try to encourage their clients to stop smoking as well. And CVS claims that it actually reduced the overall cigarette sales. And they claim that it had an impact on public health. And there's even an article in the American Journal of Public Health about it. And if you're interested, I encourage you to check it out. So the move here, while likely motivated by that rebranding campaign, really shows how a private business can have an impact on health more broadly, and also on oral health, because I know there's connections with tobacco use and oral health. Questions about that?
I had a question. Is this the rebranding, is this different than when CVS became CVS Aetna, or is it the same thing? When they merged with
don't
Aetna?
know.
Oh, it's a different thing.
Good.
Okay.
It could be the same thing. I'm not exactly sure when that merge happened. So this was in 2014.
Okay.
Yeah. Other questions or thoughts? All right. So hospital and healthcare systems are another place where health policies can be made. And so sometimes you'll have a policy that's kind of required by the law. So for example, a healthcare institution can have a policy around how HIPAA is going to be implemented at their institution. But sometimes a healthcare institution might want to implement a policy that's separate, just like a private business might. So for example, having policies around food procurement and having healthier food available inside hospitals and cafeterias. All right, and then we have this kind of other organization category, and just like healthcare institutions and private businesses as well, I just like to separate it out a little bit. So you could think about schools, for example, that could have policies that mitigate the school to prison pipeline, or you could have a food bank, for example, that has nutritional policies and standards that would ensure healthier foods get distributed to pantries and then ultimately to people who are experiencing food insecurity. Any questions or thoughts? No? Okay, so that's where we were supposed to end last week. So now let's move on to advocacy. Okay. So just a quick overview really quickly about where we're coming from. These are all the different places that you can have, you can make changes in health policy. And then at the center and the core is really that advocacy. So I want to spend a minute to kind of define as a group what we think of when we think of advocacy. So how do you think we should define it?
I can take a stab at it. I think it's actively trying to persuade another stakeholder about the importance of a specific topic or measure that affects a set population.
Great. I really like that definition. Does anyone want to add to it?
Maybe bringing more attention and awareness to vulnerable populations that perhaps don't get enough support.
Absolutely. What else do you think of? So I like, oh, go ahead. Marissa, did you want to say something?
Oh, I wasn't gonna say anything, but I guess I think of like supporting, I guess basically kind of what I think it was Claudia who just said this, but I think of support the main thing, and obviously I agree with her with like minorities and anybody really. You could be advocating for anyone, so support was the thing that popped in my head.
Absolutely. So sometimes I hear people say like being a voice for people whose voices aren't heard. Great. So I like to think of advocacy as a toolbox, and it's a toolbox that we can use to create change. So there's many tools within that toolbox that we use in kind of any advocacy efforts. And so it starts as early as when we're thinking about research. So we can use research, we can use education, we can conduct outreach, we can engage in coalition building, do some community organizing, we can draft policies, among other things. But really it's a very far-reaching toolbox. And then thinking back to Tarek's definition and Regina's and Marissa's contributions as well, we can really use advocacy to create change and to raise awareness about issues that we might not be hearing about otherwise. So at the individual level, there can be advocacy that helps an individual access resources or to get the care that they want in a certain way, or to be able to get oral health care. I know last class we talked about some challenges for individuals in accessing pediatric oral health services. But then it can also be at the population health level. And so in that case, we can create policies and change that will have like system-wide effect. So here's a process model that I just think is helpful in thinking through how policy change is made in the eyes of advocacy. And this model really applies to like various different ways of creating policies. So at any level, you need to identify and frame the problem. And then research can really be critical in creating health policies that will make a positive impact on the populations we serve, and also avoiding policies that might have a negative impact that we might not even be aware of when we're just thinking through the policy on its face. So we need to really ensure that our research, when we're starting it, is going to be framed in a way that's going to ultimately be able to have an impact on advocacy and creating health policies that will improve health. So we also need to engage community and stakeholders, and sometimes it can take a tragedy to really create change and to get that buy-in or political will. It's important to assess whether there is a readiness for change. So there's that idea of political will and community support. So if you don't have a readiness to change, then maybe it's time to introduce something like education, where you can start educating policymakers and community members on why there's an important need for the change. So you'll notice in this process model that it doesn't just end once the policy is adopted. Work really needs to be done to both implement and then support compliance and also evaluate the impact. So sometimes we'll find ourselves in a position where we have this really great policy, say for like 5-10 years, it's working really well, it's improving public health, and then all of a sudden somebody comes and they want to get rid of that policy. So if you haven't evaluated it, it makes it harder to really promote the cause and continue to advocate for why it's important to have that policy in place. So advocacy and policy change really require coordination, collaboration, and communication, as you can kind of see in the outer triangle, and then also frequent evaluation, including frequent process evaluation, just to see how the process is going. And negotiation is really critical in affecting change. Okay, so I'm going to skip some of this. One tool that we use in advocacy is storytelling. And so I want to tell you a story and then think through the story a little bit and some potential issues with it. Okay, so Alice Driver and her sons, oh, and I just want to give a content warning really quickly because this is a really heavy story. So if you need to take a step away and take care of yourself, definitely you're welcome to do that. And there's resources on campus for you as well if you need that. So Alice Driver and her sons, Diamont and Deshawn, lived in Maryland, and Alice worked as she could, but she never received insurance through her employer. Instead, her children qualified for Medicaid coverage. The family struggled with homelessness, and they bounced from one homeless shelter to another. One day, Deshawn started complaining about discomfort and pain in his mouth. Alice tried to get him to see a dentist, but it took her months to find an available provider within a reasonable distance who accepted Medicaid and who was willing to take her kids. Deshawn had previously seen a dentist, but he was kicked out of the practice. You might wonder why. Well, it was because he had trouble sitting still during exams. When Alice finally found a dentist, she took Deshawn to his appointment where he was diagnosed with 6 abscessed teeth out of 20. And can any dentist tell us, or any of you, can you just, for the public health students, explain what an abscessed tooth is?
I can go if no one minds. So an abscessed tooth is normally when you get a cavity, a portion of your tooth actually has a physical cavitation or hole in it. And if the cavity progresses, it goes from being on the outer surface of the tooth to the middle surface of the tooth to getting into the nerve. And when it gets to the nerve, that's when you normally need some form of tooth nerve treatment. I'm trying to use like lay terms here. So you might need a root canal. And if the infection continues to spread throughout the root canal system, it can then infiltrate into the surrounding bone because your teeth are housed in bone in your jaw. And it can go beyond the bone into the soft tissue surrounding the teeth, and you can end up getting a bump around your gums, which would be a localized abscess. And sometimes it can even go further and cause actual facial swelling. So that your cheek, for example, if you had a cavity, a really deep cavity that hasn't been treated for some time on a tooth down here, this part of your cheek could get swollen. And sometimes we can run into an issue where if it continues to spread, your brain is right here and your teeth are right here. So this is not a really long distance. So if you have an infection, let's say in one of your teeth up here, and it starts spreading like towards your eye, that could be a problem. Because you have a lot of vessels that traverse from your brain down. Or if you have facial swelling in the lower part of your jaw, it goes down, it could cut off your neck. It could block basically your airway in your neck, which can give you problems with breathing, which is why a lot of kids who, if they have these types of dental infections, they'll end up going to the emergency room to try to get treatment because it can be a very life-threatening situation. So I don't know if that was too much talking, but that's essentially.
It's really helpful. Thank you. I really appreciate that overview, and it actually frames us nicely for kind of where the story is headed. So basically, it's a big deal that he had 6 of those and that the infection had kind of progressed that far. So the dentist who Deshawn saw referred him to an oral surgeon to extract the teeth, but the first available consultation wasn't for 7 weeks, and then the surgery couldn't be scheduled for another 8 weeks. So you're looking here at a kid who has 6 severely infected teeth, who has to wait 15 weeks before those teeth could actually be removed. So the day of surgery was approaching, but last minute, Alice actually had to cancel the appointment and the surgery because she found out right before the appointment that the children's Medicaid coverage had lapsed. What likely happened is that a notice was sent to the homeless shelter where they no longer were, and so they missed that notice and their Medicaid coverage was canceled. So as Alice was really struggling to resolve Deshawn's issues, no one seemed to notice that her other son, Diamant, who was 12 years old, was also having trouble with his teeth. He wasn't really complaining about it until a few days after Alice found out about the lack of insurance coverage. Diamant came home from school and he complained of a really severe headache. So Alice took Diamant to a local healthcare provider where he received some medication. But despite seeking care, Diamant quickly became more sick. He was hospitalized at Children's Hospital where he underwent emergency brain surgery. He then began to have some seizures after that brain surgery, and it was discovered that the source of the brain infection that was causing the seizures was an infected tooth. So the tooth that caused that infection was ultimately removed from his mouth. And in the photo here, oops, I didn't realize there was that thing up there. In the photo, oops. Sorry. In the photo here, you can see the scar from the surgery, from the brain surgery. So Diamant's mother, Alice, is here in the background as well. The cost of his 2-week hospital stay was about $250,000. The cost of removing that infected tooth before the infection spread to his brain would have only been about $80. So following his 2-week stay at Children's Hospital, he was relocated to another hospital where he was for 6 weeks. There, he received medical treatment, physical therapy, and occupational therapy. He spent the last day of his life with his mother watching TV and playing cards. Before she left for the day, he said, "Make sure you pray for me before you go to sleep tonight." The next morning, he was dead. The death certificate listed complications of a brain infection as the cause of death. The cause of the brain infection, of course, was an infected tooth. And what really was the cause of that infected tooth?
Barriers to care and lack of access to care and the system that's in place.
Yeah, absolutely. What are some other issues you see in that story?
I mean, issues with insurance lapsing and the mom not knowing, the fact that there were providers who didn't want to take him because of the insurance he had when he did have it. And I mean, yeah, I mean, when they just all of the above.
And the providers also, I think you mentioned about the behavior, like him being dismissed from the practice. Or no, you were talking about his brother Deshawn when you said that. But his brother was dismissed, I guess, because of the behavior versus his situation is a little different, but yeah.
Absolutely. Other thoughts, other issues you see from either like a public health perspective or a dentistry perspective?
I also wanted to add support for the support systems in place for the parent with all her children and also having to make ends meet. The need for, yes, insurance, but also money, time to devote to all of her children equally, and just overall the support or lack of support that the parent had to navigate the system as well.
Absolutely. Other thoughts? Okay, so Diamant's preventable and untimely death was really a huge loss. But you may remember earlier I mentioned that sometimes advocacy efforts take a tragedy in order to create policy change. And so unfortunately, while a huge loss, his death really was a catalyst for change. It led to change in policies in Maryland that improved the ability of low-income children to receive oral health services. A project was founded in Diamant's name to improve access to oral health care in the area where he was from. And then Diamant's mother even ended up going back to school to become a dental assistant so that she could help children before they ended up with complications like Diamant. So one important thing as you're thinking about advocacy efforts, whether it's as being a dentist or being a public health professional, is really about how you identify and frame the problem. And so we just now talked about some of those issues, but I really just wanted to highlight how important it is to do that, especially as you're talking to policymakers and to people who might not be familiar with the issues. So we talked about some of the issues. And now I want to talk about some potential policy solutions. So what do you think, like thinking about the different issues that we talked about, what are some policies that could be implemented to prevent this type of scenario from happening again?
Be a safety net for folks that don't have insurance.
Okay, so having some sort of a safety net for people who don't have insurance, or maybe thinking about a safety net for people who do so that they don't lose coverage, like in this case.
Our public class, we talked like briefly, and I don't know how this would even be framed or what they would do about it, but like having time dedicated to people being able to have that time at work. So like dedicated time for healthcare. Yeah.
Great. So a policy that would let you leave work, is that what you're suggesting, to be able to take care of you or your family health care?
Exactly.
Great.
So like paid time off that's dedicated to healthcare.
Great. Go ahead, Matthew.
I know they kind of do this in like the younger kids, but schools do have like dental screenings, or like before you can enroll in some school, you have to have a dental screening. So like I guess doing more of that in which school, because you see kids like every day, they should have like days where they can do a health screening for kids, especially in areas that are not as well, like where health isn't as really accessible to them.
Awesome. Great. What are some other ideas?
I was thinking creating incentives for dentists to take on more Medicaid patients. Just specifically, I'm thinking about the Health Cares program. I don't know if any of you are aware of that program. They provide up to $300,000 for 5 years of service, and they have a certain number of certain threshold number of percentage of patients that your percentage of Medicaid patients, basically, that you have to have as part of your panel. And if you reach that level, then there's the incentive. So that could be a start if this is really, this is really tragic. So I'm just thinking about ideas that could work because we need to target the problem from multiple angles, not just one. But these are all great ideas.
I think
Yeah.
if I could chime in,
Mhm.
I think this was mentioned earlier, but a big part of it really comes to the insurance. So it kind of expanding coverage for Medicaid, because in our own clinic, for example, we have a lot of patients who come they're really young, they need a lot of treatment, and they're coming from pretty far away. They're coming from like Ventura, Bakersfield, some come from Fresno. These are really long drives because the offices that they go to, we're talking in scenarios when kids have a lot of like bombed out teeth, and some of them come and they do have abscesses. And the offices in the area, they don't provide general anesthesia, and essentially treatment under general anesthesia, like full mouth dental rehabilitation under general anesthesia, because the anesthesiologist will get compensated so little from Medicaid. They'll get maybe, I don't know, 400 or 450 when they can get 1,000 in private practice. So the office itself won't be able to find an anesthesiologist who could put a patient to sleep if need be, for dental treatment that they need. So then that ends up causing a situation where a lot of the patients get funneled to not just our school. We have a 1-year waiting list. USC, they have a bunch of hospitals they cover. They have a 1 to 2 year waiting list. So it's really a struggle for a lot of these families because the insurance itself is pretty limiting in terms of the reimbursement. And it puts a lot of dental offices in a hard crunch, because if they do see a lot of Medicaid patients, they're not going to be seeing a patient an hour, or they're not going to be seeing 10, like one provider won't be seeing 10, 15, 20 patients. They'll be seeing 50, 60 patients in a day, one provider, because they're trying to compensate for the low reimbursement by just increasing their volume. And you can imagine it's, you want to have the experience be where you get to know the family, you get to know the patient, and you understand, what are the risks of them getting cavities, so that way you can try and correct their behavior and really be an advocate for them. And that can be really difficult when you still have another 40 patients afterwards that you need to see. So I think a lot of the problems come down to how much the insurance is willing to help cover for some of these procedures. Because if it comes to be really low, it starts limiting where these patients can go to, which then ends up causing a really long backlog for patients to eventually get treatment, as we saw in this case. And unfortunately, as we see in our clinic a lot of the time as well. I don't know how it's like in other states, but this is something kind of I learned when in residency, and I was kind of shocked to hear kids coming from so far away. And I'm like, there has to be other offices in the area, but this is one of the reasons why. And that explains why us and other programs have such a long waiting list to see some of these kids. And that's not even touching base with the fact that some kids who are very medically complex, and it's not safe for us to treat them in our clinic. They have to actually be treated in the operating room at a hospital because they may have a heart condition or lung condition. And we need to get consultations from their physicians. Again, a lot of practitioners will run into barriers into trying to get an operating room to perform these really necessary procedures that not only affect their dental health, but affect their overall oral health as well. So it's really like a multi-prong, as was mentioned by one of our colleagues, Claudia. It's a multifaceted issue that's really causing this backlog, and a lot of kids who need a lot of treatment. And as was evident in this case, when the kid ends up being in a lot of pain, they're going to end up going to the ER. And they're going to sit there for several hours. The ER doesn't know. I mean, the docs, they are internal medicine. They deal with the rest of the body. They don't really deal with the mouth. So they're going to probably try to prescribe them some sort of antibiotic, if they even do that. But essentially, you get all these costs in the hospital that don't even address the problem at hand. And it's just, sucking money away without even netting a positive result in the first place. So I don't know if that was a little rant, but that's like my take as to what could be part of the problem, and that's something that really should be addressed.
Absolutely. So we have a few minutes. One thing that is really important to think about, usually I like to do a debate. I'm sorry we ran out of time. Maybe we can have another opportunity next year, Victor, to just try to have a little bit more time with our public health students and our dentistry students together. But it's important to think about the stakeholders here. So I think Claudia brings a really interesting perspective with her medicine background and her public health background, and thinking about incentives from some programs that she's familiar with. And then Tarek, it's really interesting to kind of hear you giving the flip side about how maybe those kinds of incentives aren't enough, and we need to be thinking about kind of the reimbursement rates and kind of the general structure and some of those barriers there, so that we can be addressing it. And really, in any public health or advocacy effort, you need to be thinking about it from a multi-disciplinary and multiple perspectives as well. But it's important to think about who the stakeholders are too. And so when I say stakeholders, it's not just people who are in support of whatever policy, it's also those people who are going to be opposed. So who might be opposed to, and we don't have time to go into a discussion about it now, but just I encourage you to think about it, who might be opposed to having higher reimbursement rates, who might be opposed to those kind of incentive programs, for example. And so it's really important to just kind of be thinking about that and leveraging those connections, and then trying to kind of address those who might be opposed to the policies. So I think, just kind of in the interest of time, does anybody have any questions before I just give a few last thoughts? So I really, I hope you found it valuable to have this space where the different disciplines could be together to kind of talk through some of these issues. And a question that I really just want to pose to you to think about is as a next step. So how can we really work together, whether it's public health or medicine or dentistry, how can we work together to really advocate for change? It's an important thing that none of our professions can really do alone. And I also encourage you that as you're kind of going through your career through dentistry or public health or medicine or whatever it might be, to really think about where you fit in to that advocacy effort. So I like to think of advocacy as a spectrum, and it really comes into play, as I mentioned earlier, when we're framing those research questions and designing research, to data analysis and presenting data, to organizing communities and conducting educational outreach, and then of course to drafting policies and lobbying elected officials as well, to ultimately implementing those policies. So as public health professionals and dentists, we really play an integral role at every single stage. And it's important for you to be thinking about it as you're going through your careers. So as you continue through, I encourage you to think about where your particular role is within that advocacy spectrum. So thank you so much for your time. I really enjoyed meeting you, and I hope that our paths cross again soon. I'll share the full slide deck. If you want to take a look at any of the other resources, you're welcome to. And then my contact information is also on there, so you're welcome to reach out at any point.
Thank you.
Good. Thank you.
Thank you.
Thank you so
My
much.
pleasure.
Thank
Thank you.